Hello, Assalamu alaikum. Uh, Everyone can hear me? Assalamu alaikum. I am Umar Verti, General Secretary of the AMSA Pakistan. I welcome you all on our to the speaker, Dr. UZAIR Malik, on the behalf of the AMSA Pakistan in this webinar. AMSA Pakistan is a student leading organization, which is a chapter of the AMSA International. AMSA Pakistan conducts such activities which are possible due to the efforts of our directors who plays a most role in the arrangement of the events and believe to provide assistance to the students struggle for them for the survival skills around the globe. Thanks to Dr. Hamna Zaman, our regional chairperson, whose efforts make this webinar possible. Now let's move to our honorable speaker, Dr. UZAIR Malik. Now the introduction of Dr. UZAIR Malik is graduate medical school from 2016. He worked for a few years in Pakistan as a demonstrator and give step 1 in 2018 and then step 2 in 2019. He came to US for the rotation in 2019 for the first time. Went for the research position in 2020, March to the internal medicine residence in 2021. Now move to Dr. UZAIR Malik.
Hey everyone, Assalamu alaikum. How are you guys? First of all, thank you so much for having me. I'm actually just coming back from the hospital right now, so that's why my voice might be a little on the drier side. Any questions you guys have right off the bat? All right. So thank you, Umar, for like the basic introduction. Yes, I graduated from Shalimar Medical College in Lahore 2016, and then I basically came here for the first time in 2019 for like rotations and exams and stuff, and back and forth between like 2020 and then ultimately Alhamdulillah matched in 2021 in internal medicine. So all right, let's get started. We can move on to the next slide. All right, so on this is like a very honestly brief. I just wrote in like more talking points at this point instead of like filling up like slides and stuff. You can like find all the information that you guys need online. You can go to the ECFMG website, you can go to the USMLE website. They'll have all of the details of everything that you guys need, right? If you have any issues, if you have any questions, you can just like raise your hand or like send anything in the chat box or anything, and then we can sort of definitely take care of that, right? So without hesitation, you feel free to like interrupt as needed. So I guess the first thing would be ECFMG registration, right? Currently, I think it costs like around 100, 150 or $160 or something. That's like the first step that you need to actually get registered with the ECFMG body, right? It generates you an ECFMG USMLE number, which you will like carry on like after like forever in all the exams that you book, in all the applications that you have, and even like afterwards as well when you're like actively working here, you'll have like that particular USMLE CFMG number that you'll be utilizing afterwards. Next, I would say again, the most important thing is like step one, right? Or at least it used to be one of the more importanter things a few years ago. The reason I'm saying that is it has changed, as you guys are like well aware. It has recently changed from like a scoring system to like a pass-fail system, right? Um, which that basically means that people used to spend a lot of time doing step one, right? I'll go over like the briefly what step one actually encompasses in the next few slides, right? But step one is basically your basic sciences like anatomy, physiology, biochemistry, physiology, pathophysiology, and all that stuff, as well as like biostats too. So that's what basically is encompassed by step one, right? It's an 8 hour long exam that has 7 blocks total. Maximum questions comes down to in the 270s range. So 270 to 80 is the maximum number of questions that you can have in a step one exam. Each block is further broken down into 40 questions, right? So 40 times 7, so it's like almost like 270 um, questions. You'll have 1 hour for each um, block, which comprises of like 40 questions each. 40 is the maximum number of questions in one block. You can have uh, lesser number of questions because not all the questions carry the similar mark, right? Again, we're not very concerned about step one at this point, given the fact that it's like more transition to do more of like a pass fail system versus like a scoring system that used to be before. The biggest highlight you can say of that would be the fact that initially people used to study for like months and months and months and even up to a year, like 10 months to a year to actually get like good marks in step one exam. But now, since they have actually changed it to a pass fail system, the only thing that you guys need to do is just like pass the exam and that's it. Nobody will have a scoreboard. So basically, essentially, everybody's like on the same category, on the same level, right? If you pass the exam, then that's it, right? That's all that you need. So that's one thing, which cuts down the study time actually quite a bit. I would say that even half, right? If you're studying for step one, if you're giving like dedicated study time for step one, not doing anything else, like not working or not in like house job or not in your not currently in your medical school. So you can get away with step one within like 4 months or so. Um, right. But if you're still like working and then if you're in med school and doing all everything that's like encompasses med school and stuff, so you can do your step one in like about 6 months or so. But you have to keep in mind one thing about all these exams is that it's basically on us when we decide to actually take the exam, right? Because it's not a deadline like similar to how we had like in our professional exams like back home. It's us who decide when you can actually schedule the exam. So I would say to schedule the exam or at least have like a date in mind just so you can like sort of like finalize a date. So it drives you to actually work harder to achieve your target for that deadline, right? So you're able to give that exam on that particular deadline. I know circumstances happen and people like end up postponing or like putting off their exams and so such and such. But the most important thing about step one is now that it's pass fail pass fail versus scoring, you can have it. You can be done with it in a lesser amount of time, like in like at least half of the time versus what it initially used to take. Um, Resources wise, so step one, the most common resources that people use now are obviously UWorld. UWorld is like one of the mainstays of like all USMLE exams. UWorld would be like the mainstay of everything. The next one would be first aid for step one, right? So first aid for step one would be the second thing that you can utilize for step one exam. And then the third thing that people often end up using is like any other resource, honestly. One of the most common, or like some of the common resources that people end up using is MBOS. I was told like recently that people end up using MBOS. There used to be another website. They were like fairly open to everyone without membership or like without subscription needs and stuff. That's called MedEd Online, MEDED Online. They basically had like lectures, like to the point lectures. They would just sort of like guide you on what to do, what not to do, and all that stuff. So, but they've like changed recently, and then they're like a subscription based service that you have to actually purchase now. A few years ago, it used to be like more like open to everyone. So that I would say is like step one in sort of like a nutshell, right? Um, any questions you guys have so far? Again, don't hesitate to ask any questions. Honestly, this whole thing is like organized for um you guys. So yeah, yeah, sure, I can definitely repeat the resources. So the most common resource that everybody uses for like almost all the USMLE exams is the UWorld. That's like number one. The second thing for would be obviously first aid. First aid is like a very concise, I would say. It does not give you a whole lot of uh, so let me it does not give you a whole lot of detail, but everything that's actually written in first aid is important. Like every single line is like very important. They can make like 5 to 10 MCQs within a single line of first aid. So that's why it's like very important. And next, Pathoma, yes, Pathoma is also like very essential. I'm sorry, I left that out. So Pathoma is for like basically for pathology. So that's basically why. In regards to and then obviously you can so the third option you can have like any other resource that you prefer depends on how much of a lack that you feel is there or how much deficiency you feel that you need to cover up and that sort of like defines what the third resource for you should be that some people use like Amboss. It's like an online platform. People have used like Anki cards. Those are like sort of cards that it's like an app, Anki, ANKI. There's like multiple flashcards that have already been made by like other people. You can download and utilize other people's flashcards. You can use your own or make and use your own flashcard afterwards, right? So, and definitely Pathoma for pathology, right? More so, I would say the lectures of Pathoma are much more important just so that they can sort of you can sort of like go through them just once and they can instill like a sense of everything that the pathophysiology entails, right, or that's necessary. Moving on, next I guess we have all right, syllabus for study. Yeah, there's like so again as I said that there's like stuff in there that is for USMLE exams, right? They have specific content guide on USMLE exams that are available on the USMLE and ECFMG websites. You can definitely log in there and then they can guide you specifically. I'll have like slides, I'll have like all the content in the next few slides. You can definitely go over those too. Um, Somebody else is asking sketchy for micro. Okay. So the sketchy part is it all depends on you, right? If you feel that you need sketchy, right, definitely go for it, right? Honestly, I maybe did like just a few videos of sketchy microbiology. It's honestly depends on how comfortable you are with like first aid, UWorld, and all that stuff. And then based on that, you can move ahead further and whatever else you need. So, right? Does that clarify? So the histopathology diagrams that are tested in UWorld itself, um, honestly, that's like you can never know which sort of like diagrams that they would like end up asking you, right? Um, Again, most of them are covered in UWorld, right? It's not like that they're gonna ask you something that's like very irrelevant, right? You can have like samoma bodies, you can have like, other more commoner stuff. And then obviously there's like not a whole lot of histopathology diagrams. If I say that there's like 7 blocks for like step one exam, maybe you'll have at a maximum of like what 5, 6 diagrams, maybe, right? That's sort of like the ballpark figure, I would say. But it's not like you'll have like diagrams upon diagrams upon diagrams. So it honestly depends on you how much you want to divulge into just studying diagrams. And again, more commoner ones are questioned about more commonly, right? Anything else? You guys can definitely like speak up or like write it in the chat. Again, as I said, this whole thing is for you guys, so you guys should ask as many questions as you want. So, when to give step one? Um, Again, it's very variable. It depends on when you feel comfortable, and it depends on when you actually are able to give that particular exam. During med school, I would say fourth year is sort of like the ideal time to give step one. The reason for that is you have gone through almost all of the basic sciences that are going to be tested in step one, and you're also reading about pathology. That's also part of step one. So fourth year, I would say in MBBS is sort of like the ideal time to actually go for your step one, right? Again, that's ideal. That is how people in more situated or medical school, I would say, or more medical schools who've been here for a while, like all the big ones like King Edward or Aga Khan or like Lama Iqbal and all that stuff. Most of their um, medical students end up giving these exams in their fourth and final year just to sort of like have more continuity and have like more ease at when to actually go through all of them. So go ahead, Hassan.
Assalamu alaikum, Dr. Uzair. I have a question
Claude.
for you.
Mhm.
Sir, please explain the different steps of the USMLE and their significance. Can you please
Okay, yeah,
explain the different steps of the USMLE and their significance?
sure, yeah, absolutely. I guess we already spoke briefly like about step one. We can definitely go on more about like step two as well. Um, so we'll move on, and then I'll show you like a table of content which sort of like signifies what particular topics and their appropriate fractions are tested in USMLE or relative fractions. And then Verda asked about anatomy as important to pathology. So again, that the most important thing in USMLE step one is pathophysiology. That would carry the most higher chunk of whatever you're going to be tested in. The reason for that is pathophysiology immediately precedes in medicine, and medicine is one of the most common things that are sort of like studied or tested. So that's why pathophysiology is one of the most common things tested in step one. Right. Anything else, or I guess we can like move on to step two now. All right. Hospitals now, like before getting step one. So the mood there are like a lot of hospitals in the US which would allow um, students to do rotations in here without giving step one. The reason why most big centers want step one before you actually apply for rotations there is just so they can see your dedication towards actually pursuing the field in general, right? Otherwise, there's like a lot of hospitals and a lot of clinics and all that stuff which are very open to giving rotations to IMGs who do not have USMLE exams as well, right? And then yeah, I guess this slide is pulled up. So if you look at this, these are the systems that are tested in the respective percentages on how they're tested, and the second one is the subjects, right? So as you see, like pathology and physiology are sort of like the chunk of what is actually tested, and then you can see like gross anatomy and embryology is like just a fraction of how much pathophysiology is tested. So all these tables, all of this is like available on the USMLE ECFMG website. I would highly recommend that you go through them. There's also something called the ECFMG information booklet. or the USMLE, I'm sorry, the USMLE information booklet, they come out with new ones every year. Currently, the 2023 one is out right now. And then hopefully in a few months, the 2024 one would be out as well. So they make like minor changes to all of those. So, but you can definitely go over those, and then they will have like all of these things that I'm going to show you in these slides. That's why I didn't like make anything of my own, because I mean, all these things are stuff that is available on their websites, right? And if you see the little star at the bottom on the bottom right corner, so they're subject to change. These are just sort of like a recommendation, you can say, that they have, that okay, anatomy would carry this much percentage, pathology would carry this much percentage, but we know that the most common, or the bigger chunk of the exam is pathophysiology. All right, Marva, you had a question. I'm sorry, I actually cannot hear you. Can you type it in the chat? I'm sorry, I cannot hear you. Anybody else have any questions anytime?
Excuse me, sir. I have a question for you.
Mhm.
Sir, what are the eligibility requirements for taking the USMLE exams? And how do I register for the USMLE, and what is the registration process like, stuff that?
Sure. So as I mentioned, the first thing that you need to do is register with the USMLE, or like generate like a USMLE number. So register with the ECFMG, the Commission for like Foreign Medical Graduates, right? So register with them. They will generate you a USMLE number, and then based on that number, that's when you can actually go for like the to schedule the exam, to book the exam, schedule the exam, and then give the exam. The other sort of like thing that they have is you need to be part of like a certain, your medical institute needs to be part of like a certain list that they have, that they coincide somewhat with like a list that WHO has for some reason. Again, I've not had the chance to actually go through that list, but a fair number of colleges, or almost all the colleges in Pakistan, are like sort of like recognized or affiliated, and people are like eligible to give the exam. The biggest thing about giving exam is either you need to be currently involved or like inducted in like a medical degree program in Pakistan, or like anywhere else for that matter, or need to be a graduate. So those are sort of like the requisites for you to actually undergo these exams, right? You need medical knowledge background or medical degree background to undergo these exams, right? All right, Umar, can you go back to the previous slide? All right, so moving on, step two. Step two is, again, MCQ based. It's like slightly longer than step one, in the sense that it has 8 blocks versus 7 blocks in step one. Again, 8 block means that the maximum number of questions that you can have is 318, 318. It's a 9-hour long exam, 1 hour each for 8 blocks, and then 15 plus 45 minutes for like a break that you can take at your discretion. Again, both these exams, like step one and step two in Pakistan, are conducted by Prometric. There's like 3 centers in Pakistan, the last I knew. It's like Islamabad, Lahore, and Karachi are like the 3 centers, or like the 3 places where you can have like these centers. So in regards to the step two CK exam, CK means like clinical knowledge, right? Clinical knowledge, it basically tests all your clinical sciences. So internal medicine, like medicine, surgery, OB-GYN, and pediatrics, along with like some parts of like community medicine, community health, and biostatistics. So those are sort of like what are checked or tested in step two CK. Umar, can you go forward 2 slides? One more. Yeah, so this is step two CK, right? So you can see medicine, surgery, pediatrics, OB-GYN, and I'm sorry, psych as well. Psych, and in addition to that, they also check like biostatistics and all that stuff too. So see, the major chunk even here is medicine. Why? Because medicine is sort of like the basis for all or most of your sub or super specialties that you can sort of like have. So that's why. And then you can also see like a system-based breakup of like what systems are tested in what regards and whatnot. So again, these are all like very relative. This is not like a sure shot. That's not necessary that if it's written that psychiatry would be 10 to 15%, it's not like that they would not put in like 20% MCQs in your particular exam for like psychiatry. So these are like just like for references. This is not like a sure shot thing, right? All right, Umar, we'll go back to the original slide, and then somebody else has their hand up. I'm sorry, I cannot hear you if you're trying to speak. I will go to Aksa's question in the meantime. So, internal medicine. So the thing with that is that yes, most of INGs are practicing or are doing residency or training in internal medicine. The reason for that is that that internal medicine is like the basis of everything here, right? Even if somebody is coming in for a surgical procedure and they have other medical issues going on, they would not be admitted to the surgical service. They would be admitted to the medicine service. The surgery service will just be a consult, and then they'll make their recommendations, do their procedure, and then they'll leave. But you have to deal with the patient from admission to discharge. So that's why hospitals cannot function without having internal medicine specialists, right? Internal medicine is
क्या
the most one, or like the
मैंने
residency
वे
that
मैं
has
वो ज्वाइन
sort of like
करूंगा
the
क्या
number of doctors that can actually have like the biggest number of doctors, right? So the most number of
मैंने
seats
बंदा
are internal medicine just because they're sort of like the basis of everything. But having said that, it's not that people do not match into other residencies. It all depends on how hard you want to work for like a particular residency. That's why. Like we've had like people who matched into like general surgery. We've had people who, again, it all depends on how hard you're willing to work for it. So, all right. Any other questions? All right, so we'll move on. Next, we have certification part. So when you're done with like step one, when you're done with like step two CK, the third thing that you need to do is get an OET, right? Because they need to also make sure, although you're giving like all the exams and everything in English, they need to make sure that your spoken in English or vocabulary is like up to their mark as well, right? So that's where the OET comes in. Previously, they used to have like another exam called Step 2 CS that was completely postponed, shot off the list after COVID happened, because it's like in-person exam that used to occur only in 5 cities in the US, and everybody from all around the world had to come here and attempt that exam. So which has been abolished as of COVID. So you can give OET. So OET plus Step 1 plus Step 2 makes you certified for actually applying. So that makes you ECFMG certified, right? And then that actually allows you to apply for the residency match. Step 1, step 2 CK, OET, and then you need to select one of the pathways. So since they actually abolished the step 2 CS exam, now you have to do the English language testing, the OET exam. The reason for that is that now there's like, I think there's like 6 pathways that you can take, and each of those pathways has sort of like their own different criteria, right? all those pathways ultimately lead you to getting certified with the ECFMG. The two most common pathways that I'm aware of that people end up taking, I'm sorry, I'm just going. So the two most common pathways that people end up taking are number one, the first pathway that is basically somebody who has completed medical school, right? And some and is applying to residency within 2 years of graduation. That's like the first pathway, right? And then they will take like a temporary certificate or like temporary certification or like one of those like PMC or PMDC things that allows you to do house job, which is temporary, right? The second more major pathway is people who have done house job and then they are eligible for like a fully unrestricted medical license. So a temporary medical license and an unrestricted medical license. When you have an unrestricted medical license, then there's like no cap for you to apply. But people who do not have an unrestricted medical license, they need to apply, or they are eligible to apply or eligible to get certified within 2 years or like 1 or 2 years after being graduated from their med school. Okay. Next we have Aksa's question is selection criteria for electives in the US. So honestly, there's like no selection criteria. Every place has sort of like their own particular selection criteria for everything that actually happens here. So one institute would have like a totally different selection criteria versus the second one. So there's like no sure shot about any of that. Hassan,
So I have a question
Mhm.
that if someone has passed his step one of USMLE, then what is the significance of that person in US? Can he stay in US for further medical profession in US?
Sure. So step one itself, honestly, so step one itself does not honestly carry any weightage, right? You cannot, because step one is just like a medical exam. It does not give you certification of any kind. So nobody would actually trust you with like medical skills or like give you any sort of like, unrestricted like privileges to actually work as a medical professional in the US. I mean, people give step ones, they take up like research positions for like years and years, or like they take up like they do like masters in public health, like MPH and all that stuff. But then again, step one itself does not carry any honestly weightage. It's like a whole combination of like things that can actually certify you for like further stuff. And step one, you don't need to be in the US for step one, and they would not give you like visas based on like just step one as well.
Thank you, sir.
So, then Saminal asked, so you can definitely give like all your steps like without graduating. What you cannot do without graduating is get certified by ECFMG, because one part of being certified by ECFMG is that you need to be a graduate, right? They need to know that you have completed a certain amount of medical education in a certain part of the world. So that's where like your medical school transcript comes into play. But yeah, people have given, I know a bunch of people who've given like step one and step two CK prior to them graduating medical school. Davar is asking regarding ECFNG verification expiry. So there's like two things, right? Step one and step two. Once you've started giving any of the USMLE exams, so again, the other thing that you guys should know is that you don't have to give step one first and then give step two CK. You can give step two CK first and then give step one as well. So it's like based on however you feel comfortable. I know a few people who've done like step two CK first because they were already in their final year of like medical school, which is like more clinical oriented, and they wanted to do that first, and then later they're giving step one, which is totally fine as well. And then in regards to the expiry, so the thing with the expiry part is that once you've started giving any step, whether it's like step one or step two, you have to complete all of them within a period of 7 years. 7 years is sort of like the deadline. If you are unable to give the other steps or get certified within 7 years, then whatever steps you've already given by that time, they become null and void, and you have to restart the cycle again. So step 3, no, just step 1 and step 2, not step 3. Right? All right. Then choosing a specialty, right? So as we already briefly spoke, that specialty-wise, internal medicine is sort of like the commonest specialty that people actually end up going into, just because of the sheer number of spots that there are for this particular specialty. And also, I think internal medicine, almost like 48-49% of internal medicine seats do go to IMGs. So that's sort of like the other reason. And then they need like a lot of internal medicine doctors for like inpatient and outpatient stuff. So, right. But then having said that, that does not mean that you should just limit yourself. The 3 most common specialties after internal medicine that people actually end up going into is family medicine, pediatric medicine, and psychiatry. I'm sorry, and one more, neurology. So these 4 are sort of like the most common after internal medicine that people end up going to as IMGs. So pediatric medicine, neurology, family medicine, and psychiatry, right? But we've had like very few here and there people who go into radiology, who go into maybe I think maybe we know like one person who went into like OB/GYN over the last like so many years. The next would be general surgery. Like a lot of people go in, not a whole lot, but I mean, the first surgical specialty that people actually end up going into is like general surgery. And then the next one would be other surgical subspecialties, very rarely. So based on like psych being rated higher than IM, that's a very debatable concept. Let me tell you this: like 10 something years ago, psych was lower than IM, or like, and then it sort of like slowly rose close to COVID times. Psych was like, it was much more difficult to get into psych than get into internal medicine. But now it's sort of like getting more difficult to get into internal medicine. So the trends keep on changing. It honestly, it all depends on what you actually want to do and how driven you are to get into the subspecialty that you want to go into. Right. So again, choosing a specialty is completely up to you. You have to do your research. You have to put in your time. You have to put in your effort, because ultimately it's going to be you who is going to actually do that training, right? All right, so I'll just briefly go over like the application part of it. So again, the match application, right? Basically, the ECFNG match application basically involves your USMLE steps, right? Your scores and all that stuff, your OET, your rotations, right? Where you rotated with people. Basically the reason for you rotating here in the US is like twofold. Number one is that you learn how the US healthcare system works from within, and then second one, you can have one of the attending doctors, consultants, give you a letter of recommendation that sort of like further strengthens your resolve to actually pursue applying for like internal medicine residency or like any other residency here. Then a personal statement. Personal statement is basically 1 to 1.5 page long essay, like very brief essay of who you are. It's like um, it's like you are writing about yourself on one piece of paper and telling somebody who you've never met about yourself in that one piece of paper, and that's it, right? That's basically your personal statement. Research, I mean, research articles, you can do like any sort of like research, preferably like an international journal who's like more well recognized, or who has like a, what do you call what's it, research, I'm sorry, which has like a nice, which has like, I'm sorry, higher impact factor, right? So those sort of things are which we actually consider, right? And then obviously co-curriculars, they actually want a person who's not just involved in medicine, somebody who has like a life outside of medicine as well, right? Then I guess step three. So step three is debatable. In Pakistan, OET can happen. OET can definitely occur in Pakistan as well, right? Um, OET does occur like fairly throughout multiple cities of Pakistan. So, step three, people can give it before starting residency or even after starting residency. It's not mandatory, right? Step three is like a 2-day exam, which is like all just clinically oriented. No or almost no particular basic sciences are tested in it. It's like an all clinically oriented exam, right? Um, next one would be J1 and H1. This is like a very long discussion. We can definitely tailor that for like a different time, right? So I'm sorry, give me one sec. Right. So all right, so step three, the thing about step three is it's an MCQ based exam, right? It occurs in 2 divided days. It's not a 1-day exam, it's like a 2-day exam, 8 hours one day and then 9 hours the next day. So most of step three is MCQ based. There's like you can 1/4 of the exam is like a clinical scenario based exam. They'll give you a clinical scenario, and there's like a mock software that it's like a simulation basically. So it simulates an actual case that comes to the office or comes to the emergency room or comes to like the inpatient side, and then it keeps giving you prompts, and then you have to like type in like prompts that you have to respond to. That's basically step three. Um, Overview of visa. I mean, most people who come here for like rotations are like on a B1, B2, which is like a tourist visa. You cannot do any sort of like research on it because this is like a tourist visa. Then for research, people can either have like a J1 or like an H1 visa. Then the next part would be like a residency, like J1 versus H1 visa. So yeah, that's basically it, right? And then obviously people who don't have like any visa requirements that are include what do you call green card holders or like citizens, those will not have any visa requirements, right? Expiry date of all step exams. I mean, once you've like certified and like matched and all that stuff, there's like no particular expiry date, right? I'm sorry, I didn't understand like the first question, like expiry date of steps. The next one would be so step two, also step one, step two can occur in Pakistan. Step three can only be taken in the US. So failing a step exam does not make you particularly ineligible. People who have flunked one exam still have matched into residencies here. But it's like becoming more and more rare just because like the overall competition is like getting much more tougher because more and more people keep applying every year, right? So that's why.
Excuse me, sir.
Mm-hmm.
Sir, I have a question that what would be the significance of USMLE Step 3 exam in terms of medical license and specialization in US?
Sure. So again, this step 3 exam, you can choose to give it like before starting residency or like after starting residency. You need it for or to acquire a full unrestricted medical license in the US, like after you've done your residency. That's basically the requirement for like the step 3 exam. And it changes the type of visa that you can actually acquire while doing. So if you have given step 3 residency, you are technically eligible for an H1 visa, which not all programs offer, right? But if you have not done step 3 before starting residency, then you are eligible for J1 visa, which almost all visa sponsoring programs offer. Observer before completing MBBS. So, I'm sorry, I didn't quite understand. Like observatory. So you mean like being an observer in the in like rotations and stuff. So the thing with that is observer versus elective, or observership versus like elective, right? So observerships are basically people who cannot directly interact with patients, who are just there to observe. Like, for example, you go in with like an attending or like a consultant, and then they're seeing the patient and you're just accompanying them. And then you can definitely discuss the patient after you've seen the patient with them, but not in their absence, right? That's sort of like the most essential thing. But then when you are doing an elective, you can have like hands-on experience, which basically means that you can interact with the patient solely based on how you interact, right? And that gives you all obviously like instills like a sense of confidence and all that for you as well. Um, Observerships are given to people who have graduated. No, or almost no one would like, give you electives if you graduated. The reason for that is that you're not affiliated with a medical institute afterwards. So that's why. Right?
Sir, I have another question.
Mhm.
Sir, I want to ask that how strong USMLE scores have positively impacted the candidates' residency application experiences in the US?
So you're asking how USMLE scores impact
Yeah,
acquiring residency?
yes, absolutely, sir.
So that's definitely true. Everybody who wants to go into like a very competitive residency, they prefer somebody who has like good scores, but not just like good scores. Like they want like people who have like a wholesome resume or like a wholesome CV in general. So yeah, higher or like much more competitive specialties demand that you have like higher scores, or like expect at least that you have higher scores. All right. Any other questions?
So one more much important question I want to ask.
Mm-hmm.
Sir, are there any financial considerations or cost-saving strategies to keep in mind when planning for USMLE preparations?
So, as you guys are like already aware about the whole financial situation of everything that's going on, right? Um, our Pakistani rupee is like being getting devalued like day by day and stuff. So it's definitely getting much more difficult financially to pursue USMLE, because I know that people have spent like millions of rupees just to actually do USMLEs, and then I mean it's a very individualized approach. It's a very individualized approach. If you feel like you can do it, then you should, right? But you shouldn't just do it just because like other people are doing it. USMLE is like very demanding on you mentally, physically, everything. It's like very demanding. Nobody who's driven less than 100% can do it. So you have to be very driven. That's like the first thing. That's like the first rule. I'm sorry, that's like I didn't quite understand like an overview of the rotations are basically similar to what you have like when you go into your own hospital, right? That you rotate in the hospital, you see patients and all that stuff. The only difference thing is that it's going to be in like a US based healthcare system, and somebody would, or you can request them for like a recommendation afterwards, right? Merits and demerits of ECNG registration before 2024. That I'm not sure if there's like any big changes that they're gonna like make after 2024, like in 2024. That's something that you guys can definitely look up individually. I'm sorry, I don't know the answer to one. Cost about exams. So the step one exam is like I think $1,000. Step two exam is also like $1,000. Step three is also like 960 or 980 or something like that. So everything is like at least like $1,000 just for the exams. Then you have to consider like everything else, or like add everything else in there as well. Right? Right? Um, I guess if you guys have any further questions, we can maybe take like one or two more questions and then wrap things up. Right? So again, the most important things are like towards the end of like all our discussions, I would say, is that it's like a very demanding thing, right? Medicine in general, all over the world, is like a very demanding field. You should not go into it lighthearted. You have to be very strong-hearted to actually go into medicine, and then even more so to actually pursue it and get through it. Doing USMLE, it has a big toll on you mentally, physically, financially at this point as well. So you have to consider all those options too, right? And then it's not that this is like the last resort that you guys have. There's like so many other options. Everybody's like the ultimate thing I would say is like find something that makes you happy, that gives you peace of mind, and then at the end of the day that you're comfortable and concise in whatever you decide to pursue. Okay? Umar, do you have any questions?
Okay, thank you so much, Dr. Uzair Malik, for their sparing time for moments for to us for their precious time. If anyone asks question regarding SMLE, he or she can contact us. We can convey your message to the Dr. Uzair Malik. Thank you so much, everyone, for joining the meeting.
Yeah, absolutely. It was lovely to be here with you guys. again, as Umar said, if you guys like have any questions, you can like convey it through him, right? And then I try and get in touch with you as best as I can. All right, well, best of luck, everyone, for all your endeavors and your dreams. Again, thank you so much for having me. All right, thank you.
The Asian Medical Students Association International is a peak representative organization for medical students. From numerous local chapters around the globe, training doctors from numerous local chapters combine to share knowledge, undertake activities and social services, and create international and transcontinental friendships. AMSA was officially founded in Manila, Philippines in 1985, and to this day has been an active, dynamic, and exciting student life. Non-profit and non-political organization. Today, with members and friends spanning across the globe, AMSA has an active student exchange program, owns a biomedical journal which provides AMSA members an avenue to get their works published, regularly undertakes national and regional projects, provides humanitarian assistance at times of need, produces quarterly student publications, provides opportunity for AMSA members who have graduated to maintain social contact, and liaises with numerous organizations and companies to facilitate and promote health, growth, and development for the benefit of society and our members. AMSA's biannual conferences, EMSC and AMSC, have been a key focus for the organization. Every year, these events see over 700 students from across the world combine to learn from each other, teach their fellow peers, and develop lasting friendships. For more information, you can find us on email, YouTube channel, Weibo,